Hi, welcome back to Rohrich Knose Best Podcast. And I have one of the world's best plastic surgeons with me today, Dr. Robbie Pearl, who is an amazing plastic surgeon and a long-term friend of mine. We've been friends for over 30 years, right?
For a long time. We've taught together at Stanford. We've taught together at national conferences, and it's great to be back with you, Rod.
Oh, it's great. Well, he was the CEO of Kaiser Permanente for 18 years. I can't believe it. That's amazing. He's a professor, and he teaches business at Stanford now, and he's the host of Fixing Healthcare podcast, a Forbes writer and LinkedIn top voice, and his most recent book called ChatGPT MD, How AI-Empowered Patients and Doctors Can Take Back Control of Medicine. And it's the #1 Amazon new book with all profits going to Doctors Without Borders, which is a great nonprofit, by the way. So, Robbie, welcome to Rohrich Knose podcast. Welcome back.
It's great to be in Dallas with you, Rod.
Oh, it's great. It's great. So let's take a deep dive. So let's talk about, the future of medicine. I mean, nobody knows that better than you because you're an excellent physician. You're a phenomenal plastic surgeon, and you lecture all around the world. You were telling me you're on the road 2-3 days a week, right, lecturing around the world. That's amazing.
I just came back from Zurich, where I spoke about technology and healthcare in the future. And before that, I was in Brazil at another conference. So
wow.
The world is shrinking, Rod. And you know that very well because you're always traveling
yes.
to South America, to Asia, to Europe, all over the place.
Well, that's great. Okay, so what about the future of medicine? No, what has been the biggest disruptor in the future of medicine that's going to impede us from really going to the next level?
Well, I don't want to say it's going to impede us. I want to say it's going to empower us.
Wonderful.
And that's going to be generative AI.
Okay.
Generative AI is going to totally transform every aspect of American life, global life. Medicine will not be able to avoid it. Medicine has been ultra stable for a long time, Rod, as you know.
No, I know. That's
changing.
That's very powerful. Let's take a dive into. I mean, that's a powerful word to change. Give us some examples of that.
Well, first thing I want people to realize is that not every AI is the same. And most of the AI people know is what's called narrow AI.
Right.
This is the AI, just administrative task. But what's different about generative AI is that it provides expertise, not just information. So let's look at a couple of things I'll start with plastic surgery,
right.
But I want to go into the broader area. You do a procedure, you rarely get infections,
yeah.
But you worry about it.
Right.
So you tell the patient, we'll come back in a week.
Right.
What happens in that week? You have no idea. And you want to expect the patient to figure it out? Your residents can't figure out if there's an infection sitting in the wound. They have to call you in the middle of the night.
Right.
No. We want to have a tool. This is what generative AI does. Now think about it. When we treat a resident, we expose him or her to 20 cases, 50 cases, 75 cases. You could take 10,000 patients with wounds, put it into a generative AI tool.
I'll tell you.
And have it monitored every single day so that you know, not 2 days later when there's pus, which you never see, I understand, but the minute it turns red, so antibiotics would work or wound culture would work, something would be positive. That's what we are today, Rod.
Wow. That would be revolutionary. I mean, it is revolutionary. But how do we apply that? How do we get that in? Medicine is always the last to integrate technology, and we're very slow at that. So how do we change that?
Well, first of all, I think it is changing. So it's not a question of that. I was speaking to as you say, I teach at Stanford, both the medical school and business school. And I was speaking to some medical students the other day, and I said, how many of you use ChatGPT? And I talk about that because my book, as you say, is ChatGPT MD. I like how it flows. Right. But it's whatever. You like Gemini, you like Claude. It doesn't matter which one it is.
Exactly.
Or Chinese DeepSeek. It really doesn't matter. So the issue now is going to be, how is it going to happen in medicine? And the answer is it's going to happen in medicine. Right. Because all the new doctors coming in, they're very comfortable with it. They're going to use it. The thing that they need to understand is how do you use it to transform and change medical care? Now, I gave you an example in plastic surgery, but the one that's really interesting to me is chronic disease.
Right.
Chronic disease accounts for 70% of what doctors overall do. According to the CDC, if we could control chronic disease, we'd lower heart attacks, strokes, cancers, and kidney failures by 30 to 50%. Now think about the American population.
What an impact financially and otherwise.
Exactly
and
right.
Longevity.
I mean, what's going on right now in medicine? You have Medicare squeezing doctors, lowering reimbursement. What do you have in medicine? You have prior authorization coming from insurance companies. You go down the whole list of problems because we haven't figured out how we can not just lower costs, but do so by raising quality, by improving access.
Right.
It's just been too expensive, Rod.
It has.
You can have 5 nurses in your office doing it, but that's a major cost. Now imagine if it could be done. The most interesting information right now is that the cost of a generative AI tool today, $7 an hour, as opposed to whatever you're paying to the staff that's there. Now, I don't want you to think it's going to cut all the jobs out, eliminate all the people.
Right.
But how much better job could they do for you in an operating room? How much better could they do counseling patients, helping patients, doing all the things that we need to do that today are spent being able to do these bureaucratic tasks?
Yeah, that's amazing. 30 to 50% reduction. Wow. So what steps are being taken today by globally, like in the U.S.? I mean, we're probably lagging behind.
Well, I don't think it's a question of the U.S. lagging behind, although it's true. I was just in Brazil, and they said, now this is one hospital system, but with 40 hospitals, 95% of the EKGs are being read by a generative AI tool.
And it's accurate?
Yeah, incredibly accurate. As good as clinicians are. Again, I don't know how closely your viewers and listeners follow this, but if you listen to the leaders of the generative AI tools, we're talking about OpenAI, we're talking about Anthropic and places like that, they're predicting we're going to get to what's called artificial general intelligence, AGI, in between 2 and 5 years.
Wow.
Now that means the technology will be as good or better than clinicians. And we have to recognize that. Because, Rod, if we don't lead it as clinicians, I will tell you what's going to happen. For-profit companies and private equity are going to come in.
Take it over.
And they are not going to prioritize either patient outcomes or clinician satisfaction.
You're right.
And so this is the moment we need to seize, and why I was so happy to be on your podcast today to tell your large viewing audience.
So what do we as physicians need to do? I mean, we need to embrace it. We need to learn it and not be afraid of it, but to say, this will help us become better doctors and deliver better care, right?
Well, the hardest challenge, I think, for us will be culturally.
Right.
I will be very clear. There's a lot of ways that patients get information, many of which is misinformation.
Right.
They go to Google, they click on a link, they read a study. This provides expertise. You have a patient who has a problem and they want to know more about it. A generative AI tool can give them information, and if it's well trained, it's going to be exactly what you as a clinician would do. And I'm encouraging everyone in medicine, try it. Put the information in place. Pretend you're the patient. Put the information in place and see how it compares to what you would tell the patient, or you did tell the patient. And I'm going to be, I'll say, almost guaranteeing it's going to be so similar, you're going to say, oh my gosh, I could use this to educate families. I could use this so they know what's going on. You know, I was on a podcast, a different podcast. At the end of the show, the host said to me, Dr. Pearl, you're a skier and you're a clinician. My husband fell skiing. His arm was over his head and he slid about 100 feet. And now it's 3 months later, and he still can't use that side as well as the other side. It's still painful. What's going on? I said, I think I know what's going on, but I'll tell you what. You said you've never used this tool. Why don't you put the information in place and see what it says? She calls me back 5 days later. She said, thank you so much. It said that he probably had a rotator cuff tear, that he needed an MRI to establish a diagnosis, and he should see an orthopedic surgeon because he almost definitely needed to have a procedure performed. Compare that to a Google link. It wouldn't work at all. And now, as the doctor, don't be afraid of that patient. Wouldn't you like the patient to know
100%
what's going on? And of course, she said the surgeon diagnosed a probable rotator cuff tear, ordered the MRI, and
Did the surgery.
Did the surgery, and afterwards said, if you'd waited 3 more months, I probably could not have gotten the tendon back to the bone. That is true expertise, and we are used to telling patients what to do, not empowering patients to understand what it is that needs to get done.
Right. I mean, that's certainly the quantum difference that ChatGPT and AI, because Google will just give you 1,000 answers, of which 70 may not be right. So
that's correct.
I mean, it is amazing. So I want to get back to what did those Stanford medical students say when you said how many are using AI in your training? Because my daughter's becoming a medical student. So what did the Stanford students say?
Every one of them said, yes, I do, and I will guarantee your daughter is using it today.
Oh, of course she is.
That when she took her MCATs, she used it to study.
Of course.
Because why would you not have that tool? It's like, imagine having Rod Rohrich on your shoulder all the time, giving you information, giving you advice, giving you perspective.
And it's okay.
Yeah.
It's better than okay. It's essential today, right?
It is essential to moving forward, and we have to start to see that. I'll give the viewers, listeners, one other thought. This technology is doubling in power every year. That means 5 years from now, it's going to be 32 times more powerful. Don't think about what exists today. Today, we have to get ready for what's going to exist tomorrow.
So how do physicians not say, oh my God, they're going to take over my position? How do we get over that?
I don't think doctors will ever disappear. Patients want that human touch.
They want it to be more accurate.
But they want it to be more accurate. Absolutely. And that's what we have to understand. But it's going to change the relationship. I don't need to see you in my office if you're doing well. Up to now, I never knew if you're doing well. You better come in, because how else will I know? Now you know what's going on. You could have done a telemedicine visit. You could have had an RN take care of the patient. But that was either expensive in terms of paying someone or expensive relative to your time. Now we have that tool to do it. And we should be figuring out, how can we use it? The example I gave you post-operatively.
Yeah.
Let's try it. Let's do a big study. And let's not have one doctor and one doctor. Let's do it together. Figure it out. Either we're going to lead the way or someone else will, and we will pay the price.
Right. Yeah. And so medicine needs to embrace it and not say, oh, we're scared of it. We need to embrace it and use it to enhance patient care. I mean, that seems so logical. But so what's the hesitation in the medical profession? What's going on? Why are people hesitating? I mean, I know the young physicians are not, but what about people that are out in practice?
Well, as you know, I have a monthly Musings newsletter that comes out, and people can subscribe. There's no cost and no advertising, sitting in play. And when I asked people a year ago, 25% of people were using it. Now it's 75%.
Physicians or?
Yeah, physicians, but both physicians and patients.
That's great.
Yeah, it's definitely evolving, but as I say, it's happening so fast. We have to get to the front of that curve. And most of your viewers are going to be plastic surgeons. I understand that. But the rest of medicine, the people who are going to prevent the problems from happening, ones that we could avoid. I mean, I don't know if you see the statistics. 400,000 people die annually from misdiagnosis. 250,000 people die annually, preventable medical errors. We do such a bad job controlling chronic disease. 500,000 people will probably die. This is a remarkable opportunity. And no one should make the mistake of thinking, oh, we're plastic surgeons, we're immune from this whole process, because we get impacted by that. The Medicare reduction in payments affected people who are doing breast reconstruction surgery, as an example. Right. And so we pay the price, and we need to be helping to lead the effort, even if in the specialty we're in, it's predominantly technical and far less analytic.
Wow. I mean, talk about transforming medicine, transforming outcomes, not only in plastic surgery, but everything. So amazing advice from an amazing leader in all of medicine and plastic surgery on where we're heading in AI and in medicine today. So please give us your thoughts and your comments. And until next time, stay informed and stay safe.